Welcome to the fascinating world of microbiology. Microbiology is the study of small living organisms, including bacteria, viruses, fungi, and parasites. The term itself comes from micro meaning small, bio meaning living, and ology meaning study. Understanding microbiology is essential, especially for barbers and other personal service workers, because it helps prevent the spread of disease within the workplace. By learning about these tiny organisms, you can protect both your client's health and your own. In this video, we'll explore the basics of microbiology, its importance, and how you can apply this knowledge to create a safer environment for everyone. Bacteria are also known as germs or microbes. These are one-celled microorganisms that exist everywhere around us. There are two general classifications of bacteria: non-pathogenic and pathogenic. Non-pathogenic bacteria are harmless and can even be beneficial, while pathogenic bacteria are the ones that cause disease. Understanding the difference between these two types is crucial for anyone working in environments where hygiene is important. Bacteria are incredibly diverse and play a significant role in both health and disease. Non-pathogenic bacteria do not produce disease and can actually be beneficial. For example, saprophytes are a type of non-pathogenic bacteria that live on dead or decaying matter, helping to recycle nutrients in the environment. In fact, about 70% of all bacteria are non-pathogenic, and many of them live on the surface of our skin. These bacteria play a vital role in maintaining a healthy balance and protecting us from harmful microbes. It's important to recognize their positive impact and not view all bacteria as dangerous. Pathogenic bacteria are the ones that can cause infection and disease. Some of these bacteria produce toxins and are found everywhere, making them easy to spread. They come in three basic shapes, and when a disease spreads from one person to another, it is called contagious or communicable. Examples of diseases caused by pathogenic bacteria include the common cold, hepatitis, and measles. Understanding how these bacteria operate and spread is key to preventing infections in the workplace. Cocci are round-shaped bacterial cells that can appear in groups or individually. There are three main groups of cocci: Staphylococci, which are pus-forming and found in abscesses, pustules, and boils; Streptococci, which are also pus-forming and cause strep throat, forming in long chains; and Diplococci, which grow in pairs and cause pneumonia. Recognizing these different types of cocci is important for identifying infections and understanding how they spread. Bacilli are bar or rod-shaped bacterial cells and are the most common form of bacterial cells. These bacteria are responsible for causing fever and other illnesses. Their shape allows them to move and reproduce efficiently, making them prevalent in many environments. Understanding the characteristics of bacilli helps in identifying and controlling infections caused by these bacteria. Spirilla are spiraled, coiled, or corkscrew-shaped bacterial cells. These bacteria are known for causing highly contagious diseases such as syphilis, cholera, and Lyme disease. Their unique shape allows them to move in a twisting motion which helps them spread quickly. Recognizing spirilla is important for understanding the transmission of certain serious diseases. Bacteria go through a growth cycle consisting of two stages: the active stage and the inactive stage. During the active stage, bacteria reproduce and grow rapidly, especially in dark, damp, and dirty places with food. They absorb food, grow, and divide. In the inactive stage, when conditions are unfavorable, cells die or become inactive and some form spores. When conditions improve, these bacteria can become active again. Understanding this cycle is crucial for controlling bacterial growth in the workplace. Bacteria move in different ways depending on their type. Cocci bacteria move through air or dust, while bacilli and spirilla move by themselves using hair-like projections called flagella or cilia. These structures help them swim and spread in their environment. Understanding how bacteria move can help in preventing their transmission and controlling infections. Viruses are even smaller than bacteria and are responsible for causing familiar diseases like the common cold, measles, hepatitis, and more. Unlike bacteria, viruses require a living host to multiply and cannot be treated with antibiotics. Vaccinations are a preventative measure for certain viruses, helping to protect against infection. Understanding viruses is important for preventing the spread of viral diseases in the workplace. Several viruses are important to understand in the context of workplace health. Hepatitis A is transmitted through person-to-person contact or contaminated water. Hepatitis B and C are bloodborne pathogens that cause highly infectious diseases affecting the liver, and vaccination is recommended for personal service workers. HIV can lead to AIDS and interferes with the body's immune system, spreading through body fluids. HPV can cause health problems such as genital warts and cervical cancer. Awareness of these viruses and their transmission is vital for maintaining a safe environment. External parasites, such as mites and lice, need a host to survive and can cause contagious diseases. These parasites are easily transmitted and often accompanied by symptoms like head scratching, redness, and bite marks. Parasitic fungi, including molds and yeasts, can produce contagious diseases like ringworm and non-contagious conditions such as dandruff. Controlling these organisms is important for maintaining hygiene and preventing the spread of disease. Infection occurs when pathogenic bacteria or viruses enter the body and multiply, interfering with the body's normal state. There are 6 signs of infection: pain, swelling, redness, local fever, throbbing, and discharge. Recognizing these signs early is crucial for preventing the spread of infection and ensuring timely treatment. Maintaining hygiene and monitoring for symptoms can help keep the workplace safe. Infections can be transmitted directly or indirectly. Direct transmission occurs through touch or exchange of body fluids, while indirect transmission happens through air or contact with contaminated objects. Contagious infections can spread from person to person through touch or air. Bloodborne pathogens are carried through blood or body fluids and can be spread in the workplace whenever skin is broken. Understanding these modes of transmission helps in preventing infections. There are several ways infection can spread in the workplace: open sores, unclean hands and implements, coughing or sneezing, common use of drinking cups and towels, using the same implements on infected and non-infected areas, and unsanitary shop conditions. If you have a contagious disease, it's important to practice infection control procedures to prevent spreading the infection to others. Maintaining cleanliness and proper hygiene is essential. There are 2 basic classes of infection: local and general. Local infections are located in a small area, such as a pus-filled boil or inflamed area. General infections affect the whole body and are systemic. Understanding the difference between these types helps in identifying and treating infections appropriately. Always monitor for symptoms and seek medical advice when necessary. An asymptomatic carrier is someone who carries a disease without showing any signs or symptoms. This is why standard precautions should always be used with all clients, regardless of whether they appear healthy. By following infection control procedures consistently, you can prevent the spread of disease from asymptomatic carriers and protect everyone in the workplace. Standard precautions involve using the same infection control procedures with all clients, regardless of their health status. This includes proper hand hygiene, cleaning and disinfecting tools, and using protective equipment when necessary. By consistently applying these precautions, you can minimize the risk of spreading infections and maintain a safe workplace environment. Immunity is the body's ability to destroy infectious agents that enter the body. There are 2 types of immunity: active and passive. Active immunity occurs when antibodies are produced after exposure to a disease, either through infection or vaccination. It takes time to develop but is long-lasting or lifelong. Passive immunity involves antibodies given to a person, providing immediate protection but lasting only a few weeks or months. Understanding immunity helps in preventing and managing infections. Active immunity develops when the body produces antibodies after exposure to a disease, either through infection or vaccination. This process takes time but results in long-lasting or even lifelong protection. Vaccines are a key tool in building active immunity, helping to prevent the spread of infectious diseases in the workplace and community. Passive immunity occurs when antibodies are given to a person rather than produced by their own immune system. This provides immediate protection but only lasts for a few weeks or months. Passive immunity is useful in situations where rapid protection is needed, such as after exposure to certain diseases. Understanding both types of immunity helps in managing health risks. Basic knowledge of microbiology is crucial for barbers and other personal service workers. By understanding how microorganisms operate and spread, you can implement effective hygiene practices and infection control procedures. This not only protects your clients but also ensures your own safety. Regular training and awareness are key to maintaining a healthy workplace. Preventing the spread of disease in the workplace involves several steps: maintaining cleanliness using disinfectants, practicing proper hand hygiene, and following standard precautions. By being vigilant and proactive, you can reduce the risk of infection and create a safer environment for everyone. Remember, prevention is always better than cure. Recognizing the symptoms of infection early is vital for preventing the spread of disease. Look out for signs such as pain, swelling, redness, fever, throbbing, and discharge. If you notice any of these symptoms in yourself or your clients, take appropriate action and follow infection control procedures. Early intervention can make a significant difference. Hygiene is the foundation of infection control. Regular hand washing, cleaning tools, and maintaining a clean workspace are essential practices. These steps help eliminate harmful microorganisms and reduce the risk of disease transmission. Make hygiene a priority in your daily routine to ensure a safe and healthy environment for everyone. Disinfection is a critical step in infection control. Use appropriate disinfectants to clean tools and surfaces regularly. Follow manufacturer instructions for concentration and contact time to ensure effectiveness. Proper disinfection helps eliminate pathogens and prevents the spread of disease in the workplace. Personal protective equipment, PPE, such as gloves, masks, and aprons, can help reduce the risk of infection. Use PPE when handling clients, cleaning tools, or dealing with potential exposure to blood or body fluids. Proper use and disposal of PPE are essential for maintaining safety and preventing disease transmission. If you or a client has a contagious disease, follow infection control procedures strictly. Avoid contact with others, use PPE, and disinfect all tools and surfaces. Notify relevant authorities if necessary and seek medical advice. Handling contagious diseases responsibly helps protect everyone in the workplace. Continuous education on microbiology and infection control is important for staying updated with best practices. Attend training sessions, read relevant materials, and stay informed about new developments. Ongoing learning ensures you are prepared to handle health risks and maintain a safe workplace. In summary, microbiology provides essential knowledge for preventing the spread of disease in the workplace. By understanding bacteria, viruses, fungi, and parasites, and applying infection control procedures, you can protect your clients and yourself. Remember to practice good hygiene, use standard precautions, and stay informed through continuous education. Creating a safe and healthy environment is everyone's responsibility.